and live on Facebook.
All right, what's going on, everybody? This is Dr. Schilling bringing this week's Wednesday Wellness Minutes, and we're super excited to bring you this week's information regarding the thyroid. January apparently is Thyroid Health Month, and we talk about thyroid every day here in the clinic, but we wanted to bring you some information that you're never going to get from your endocrinologist because they just don't have the time or the background in terms of providing this information. So we're going to give you the deep dive here into how you can evaluate and understand your thyroid health so you're more empowered as you move forward, working either with your endocrinologist, your general practitioner, or your natural health care professional. For those of you who don't know much about the thyroid, there's a lot of different symptoms that can mimic the thyroid, but generally speaking, people associate it with hair loss, thinning hair, lateral part of the eyebrow, losing that part, weight gain, cold hands and feet, brain fog. There's just a list that goes on and on. Constipation's a huge one. No motivation, brittle hair and nails. Those are big time problems as far as people associate the symptoms with the thyroid. The big thing you want to take away from this is, unless this is my joke, unless you've been hit in the throat by a hockey puck or been kicked by a mule or some other injury to the thyroid is not the primary issue. Maybe if you've had some radiation sometime exposure there, that might be an issue as far as damaging the thyroid, but we want to understand that thyroid is generally not the primary issue. It's usually secondary or, as we say, tertiary, which means third in the row in the line downstream from something that's been a problem. Some of the other side of what I just talked about, which was the hypothyroid symptoms, we have the hyperthyroid symptoms, which is much, much less common. So we're thinking about goiter, which is an enlargement or some nodules on the thyroid itself, which if you don't know where the thyroid is, it's right here in the neck. The men have an Adam's apple, it's right around that area, and the women have an Eve's pear right around this area. It's really important to understand that if you ever feel a nodule in there, you want to make sure it's not a lymph node, that it's actually part of the thyroid gland. Make sure you have a professional palpate it or touch it and make sure it is what it is. But you can have racing heart, anxiety, increased sweating, palpitations in the heart, muscle weakness, difficulty sleeping, irritability, anxiety, eyes bulging out, exophthalmos as we call it, restlessness and things like that. Those are signs of hyperthyroid, which is, again, as I said, much less common. The more common issue that people have in our country is typically associated with what's called Hashimoto's autoimmune thyroiditis. And this is an autoimmune disease. Some doctor with the last name Hashimoto put his name on it, or her name on it rather, pardon me. We don't know who it is. I'm sure you could look it up on YouTube or Google or something like that. Somebody tell you what it is. But it's basically, the assumption is that 80 to 90% of people in the US have an autoimmune condition as a result, or a thyroid condition as a result of an autoimmune condition. And when you go to a medical professional, basically, if you have an autoimmune disease, the best thing you're going to get is some type of immune suppressing drug, something that's going to try and control your symptoms. What we need to do is support the body, figure out what the root cause of your symptom and your issue is with the thyroid, and make sure, is it the primary or is it secondary? If it's secondary or tertiary, let's find out what the root cause is. So let's kind of dive into this. I'll be using sort of the chart up here to give you some more information, but there are, generally speaking, 7 things that I look for. We'll talk about foods, toxins, hormones, so that could be sex hormones, adrenal hormones, things like that. I'll go like stress, infections. Okay. Then we have injuries. All right. And I don't know how well you can see that, but Amelia's going to try and zoom in on it. And then we have neuro-emotional issues. So these are the 7 things that I consider as probable candidates for causing your thyroid condition. And again, in the absence of trauma to the gland itself. Amelia's having definite good times with the zoom.
Back out.
Oh boy. All right, so you're getting a super zoom on the old Facebook there. So understand that these are the 7 factors that I take into consideration because any one of these or a combination of them can and or will or are causing your thyroid symptoms. Foods. Soy is a well-known issue for the thyroid. Gluten is definitely a well-known issue for the thyroid. Iodine deficiency, so if you're not getting enough kelp and spirulina and things like that, you're not going to get enough iodine. Amelia should get it here in a second, hopefully. Moving on to toxins. Xenoestrogens are pretty common as far as causing thyroid problems. Xenoestrogens, xeno meaning environmental. Estrogen, of course, mimicking the hormone function of estrogen in your body. So xenoestrogens are big time problems. Beauty products are huge. My wife Sarah dove headlong into Beauty Counter as a result of finding out more information about xenoestrogens and toxicity in the beauty counter, or in the beauty industry rather. So keep in mind that what you're putting on your body goes through your skin and gets in your bloodstream, and your liver has to detoxify it. If your liver can't detoxify it, it's stuck in your body and it will get stuck in different receptor sites, which means the keyhole where your thyroid hormone is supposed to go in and turn on the key might be blocked. It might have some putty or some junk covering over it. Hormones. Big time issue here is stress. Cortisol will disrupt. Cortisol is a stress hormone if you don't know what that is. It comes off of your adrenal gland in your low back on top of your kidney. It will throw off your T4 to T3 conversion big time. So it will not allow you to convert your hormones into the active form which you need. It's a big time problem. Stress. So stress is what causes the issues with cortisol. So as stress rises, it causes excess dysfunction in the thyroid hormone and the conversion from the T4 to T3. Okay? T3 is your active form. You need a free form of that, free fraction of that for it to actually be functioning. So these two are sort of play off each other. Infections. You can find bacteria, molds, funguses, parasites, viruses, whatever you can think of might be imbalancing the system. So if a parasite or a virus is causing stress in the liver, decreasing your detoxability in your liver, you're not going to be able to convert your hormones. If you have a bacterial or fungal dysbiosis or imbalance of your bugs in your gut, you're also not going to be able to convert this. Injuries could be to the head, right? Car accidents, slips and falls, anything you can think of. So it could be the front of the head, the back of the head, anywhere on the head. Any type of concussion or post-concussive syndrome can disrupt the functions of the brain from the thalamus to the hypothalamus to the pituitary, and then the pituitary sends a message down to the thyroid and so on and so forth. This can be a big time problem. Tailbone injuries are also going to affect along the back line of the spine. That's called your governing vessel. Starts at the upper lip, wraps around down to the tailbone, and then, or it could be your conception vessel on the front, starting at the perineum or the space between, the fleshy part between, anatomy lesson here, between either the vaginal opening or the anus and or the scrotum and the anus. That is called the perineum. And if you have an injury there from a birthing process, like many women do that are at least have given vaginal birth up until now, that can cause a reflex up the line, which can shut down the thyroid. Falls to the tailbone, hits the head, they can shut down the governing vessel, which is going to limit the thyroid function because the brain will not properly communicate with the thyroid. So that can be a big time injuries. Those are called interference fields. We help you find them. They're easy to fix, okay? But that can be a silent killer, if you will. No serious killer. I'm just talking about silent challenge. Neuroemotional. This is a big time challenge. People who are feeling powerless, feeling that they have no voice or have no say in matters and or in their life, they feel like they're on the defensive all the time and they can't assert themselves. Neuroemotional stress. The thyroid is right here within your throat chakra. If you're understanding the chakra system in Ayurvedic medicine or Ayurveda, you understand that the throat chakra is your power center. It's your voice. It's your strength. And therefore, if you have experienced a major situation in your past where you've lost your power, lost your voice, been unable to assert yourself, the neuroemotional side can be a big problem. So I get to see if I can actually, yeah, here we go. We get to erase that. So what you want to appreciate is it's not as simple as one would think about if you have a hypothyroid symptom. We'll stick to hypothyroid right now because it's 95% of everything that people are challenged with. If you think about thyroid issues and hypothyroid being the biggest problem, it's not enough to just take a synthetic hormone in the form of levothyroxine or Synthroid, or if you're lucky and you have an endocrinologist or a GP that's actually out of the box and they're thinking about Nature-Throid, West-Throid, or something else like that, you understand that if you're taking a hormone in, it still has to be converted to the active form. It doesn't matter if your body produces it or if your hormone's coming in synthetically. So the big factor is the T4 to T3 conversion. So let's just draw a simple diagram. So for lack of better explanation, that's your brain, okay? And you have, let's call it, this is not anatomically correct, so don't worry about that. But let's say we have the thalamus going to the hypothalamus to the pituitary, okay? And just get the general idea. If you need to zoom in on this on your phone, fine. So you got the TRH from the thalamus to the hypothalamus, and then the thyroid stimulating hormone, okay? So what we need to understand is we're going to send that cascade down, and we'll just draw a nice little butterfly, okay? That's your thyroid gland. And so from there, what we're going to do is we're going to produce something to the 93% of T4, okay? And then we have 7% of T3. Now this is the only part that's actually active in your body, only part. So this part's going to go off to, we'll call this the cell over here, and you got this thing called the thyroid binding globulin, okay? So this is like the little bus. Think of this as a big semi, all right? A bunch of wheels on there. TBG, so the T3 is going to hop on here, it's going to zip around here, and it's going to cross into the mitochondria. Okay? Mitochondria is inside the cell. So this is the cell, mitochondria is inside the cell. That's where your energy is produced. Mitochondria is where your energy is produced. So you have to have this form going out to the cell, then going across the cell in the free T3 form, which is like the key turning on the engine in the mitochondria, which is going to produce your energy. Okay? This is really important to understand. So from here, this stuff goes down to a big organ called your liver. T4 to T3 is 60%. T4 to reverse T3 is 20%. And T4 to T3 acetic acids, okay? Those go off to, and I'll just do a bunch of spaghetti here. This is your gut over here, okay? So that gets converted at your gut. So this is where your microbiome and your digestive system is very important. So you need to have this understanding that you're producing mostly T4, which is completely worthless. If you're taking levo or synthroid, okay? Both this generic and prescription, or the original, these are synthetic. They still have to be converted here and or here, at your gut, in order for them to actually take effect. So this is really important because you're still going to need those TBGs. Okay, this guy over here, your little bus, to drive these guys down to the liver, and or, you got another bus over there to take them out to the gut. Okay? So this is a general understanding that no one in the medical field is going to sit down and write out for you. They're never going to help you understand that, because what they're going to measure is your TSH and your T4, typically. That is basically, this is called the standard of care. Standard of care. Look it up. Standard of care for thyroid care is related to measuring the TSH and the T4. If you have someone not thinking outside the box, they might test your T3 or your free T3 and free T4. What you need them to check is how much is going to reverse T3. Okay? If you're getting a ton of reverse T3, that means this ratio that's supposed to be only 20% is probably up to about 60 or 70%. Okay? Long and short of that, just to simplify things, if you're kicking out mostly reverse T3, you can take a dump truck and back it up and start shoveling T4 into your mouth or into your body intravenously, whatever you want to get it in, and you're going to have problems because it's not going to be converted. So if you have a toxic liver, if it's sluggish, if it's not detoxifying, if you're getting irregular periods, if you're getting night sweats, if you're getting hair loss, if you're getting brain fog, bloating in your gut, liver, big time. I would say that 90% of the problem here with people with hypothyroid issues is the liver, okay? Which usually leads to toxicity being floating around the body, and that actually gets stuck back in the liver, or in the thyroid rather, which means when the active hormone goes around, it can't even send the feedback system, right? So then if we have, let's say, this might get a little messy. We'll get the kidney beans down here. See if I can draw. Okay, and then you got a walnut-sized gland. So those are your adrenal. And this is your kidney. Okay? So remember, these guys put off cortisol. And this is going to wreak havoc on that. Okay? It's going to stop the conversion of T4 to T3, which is what you need to have happen. Okay? What I would suggest you do if you're working with your endocrinologist, email us and ask us for this sheet right here. We'll send it to you in an email, either an Excel form or in just a graph, and you can print it off, or you can come in and get it here at the clinic. What you'll notice here on the left side is the laboratory range, which is the range that the medical doctors use to reference whether you're healthy or not. On the right side here, you have the functional range, which is where we actually evaluate your health. What's most important is that this is a much narrower band. It's much more difficult for people to stay within this band. And the reason why this one's so much bigger is because the insurance companies dictate what this wide range is so that more people fall in the normal range and they don't have to pay. It's very convenient, okay? So big takeaways here. T3 is the one you need to focus on. T4, measuring that, not going to do you much good. Measuring your TSH and your T4, generally speaking, your hormones are on a teeter-totter, right? Okay, so as T4 gets low, your brain's going to say, oh, we need to raise our TSH. As T4 starts to rise, your body's going to lower your TSH. T4 is going to go up, and it's going to try and find that balance point somewhere in between. What you need to understand is if they send you into the lab at 8 o'clock on Tuesday morning and they take your blood, you could be anywhere on this scale. Okay? We'd like to see in a tighter band, but you could be anywhere on that scale. So 2 hours later, you could be here, you could be here, just depends on where you're at. If you're both up or both down, that's indicating more of a brain problem, typically speaking, or some type of maybe what's called an adenoma or tumor of some sort. Could be the pituitary, could be the thyroid. It's hard to say. It just depends on what your symptoms are and what is found on a CT if necessary. So this gets a little bit jumbled. You're probably going to want to watch this again. Feel free to come in and talk to us about it. It's not as complex as you think, but remember, foods, toxins, stress, hormones, bugs, injuries, and neuroemotional stress. All of them, any one of them in concert with another can cause a thyroid issue, mostly hypothyroid. Okay? In the absence of trauma, the body breaks down on the inside before it breaks down on the outside. So what you want to understand is, if you're having symptoms and you haven't had a trauma of radiation or some type of physical trauma, the likelihood of it being a primary thyroid issue is not high. It's going to be something else in the body, gut, liver, brain, thyroid, some combination of those. Okay? So I hope this has been reasonably understandable from a basic standpoint of the physiology and how it works. But really what you understand is you're never going to solve a problem of a hypothyroid issue with simply taking T4. Okay? Eventually they're going to start raising your medication levels and up and up and up, and then they'll try to drop it down if you get too hypo or hyper. So you start getting jittery and shaky and sweaty and heart racing and stuff like that. They're going to try and jockey it down. But there's much more to the picture as you understand from looking at this graph and understanding this diagram that it's way more complex than simply saying, oh, how's my TSH and how's my T4? You have to expand out the lens. You have to expand back. You have to widen the lens and say, what's the true picture of the health? What's the true picture of the body? How's my gut? How's my digestion? How's my microbiome? How's my liver detoxifying? How's my brain functioning? Right? Is there an injury to the head? Is there an injury to the perineum? Is there an injury to the tailbone? Somewhere along there. Is there a surgery on the spine that then cut along the governing vessel? Is there a C-section scar? Is there an appendix scar? Is there an open heart surgery scar? All of these injuries can affect the brain and or thyroid function abnormally. Feel free to give us a call, send us an email, let us know what questions you might have in order to provide you more information about this. It is not as complex as this may seem. Your job is not to understand it. Your job is to share your experiences and what's going on with you so we can dig down and find the root cause of your challenge and illuminate for you, shine the light on what the true cause is. So you don't have to be stuck taking medications for the rest of your life and feeling crummy. Because I can't tell you how many hundreds of people have walked through the door of this clinic, probably thousands, and said, I'm on medication and I feel crummy. It's not that your medical doctor is not trying to help you. They're literally, if you are dying and need your life saved or be kept alive, they are the experts. When it comes to getting you past stable and enjoying life again, that's where we come in. So keep that in mind. Share this with your friends and family. Let us know if this has been beneficial for you. If there's some areas of this that are too complex and you don't understand them and you want more information, please let us know. We're happy to type something up and let you understand, get you the information so you understand it better. Okay? So shoot us a message. Let us know if you have any questions. Let us know what else you'd like us to comment or discuss in these Wednesday Wellness Minutes, because these are for you guys. We want to do this in order for you to be empowered to understand your health, because this information, I can assure you, is not going to be given to you in your next consult with your endocrinologist. It's not going to happen. The insurance companies won't pay for them to spend that amount of time with you. So hopefully this is empowering for you to understand just how many intricacies there are with the thyroid health, but understand that we have the technology here to dig down and find out what the root cause is. We're going to treat you and help you heal like a person and not like, oh, you're a thyroid gland. Here are all your symptoms, but we're going to treat one gland in your body. You're way more complex and deserve way more care than that. So understand that. Let this gloss over you and get a broad understanding of what it is, and then send your questions for us. We're happy to help, all right? Let us know what you want us to comment on. Let us know what you want us to speak on, because we're here for you, okay? It's our pleasure to serve you, and we look forward to seeing you next week for the Wednesday Wellness Minutes. See you guys.